For weeks, Governor DeSantis has promoted monoclonal antibody treatments to help people with COVID-19. The goal is to get people out of the hospital and keep them out of there. Brevard County is one area using the treatment, and they have seen some good results. And joining us right now to talk more about this treatment is Brevard County Director of Communication, Don Walker. Don, good to see you this morning. Thanks for being with us.
Thanks for having me.
So let's start with the question of how has this treatment been received in Brevard County?
Well, we're actually seeing a tremendous turnout, in my opinion. We set up the state actually set up a facility at one of our local parks, Kiwanis Island Park, which is off of 520 in Merritt Island, to do the monoclonal treatment. And they were ready to meet a capacity of at least 300 people a day. And we're seeing between 200 and 300 people a day. To this point, we've done just about 4,000 treatments since we opened about a week and a half ago.
Don, we see it a lot in our business. We'll report things that people will hear monoclonal treatment and they're aware of it, but they're not aware exactly what it is. So what is your message to people curious about what this treatment is and exactly who needs it?
Sure. So the monoclonal treatment won't prevent you from getting COVID, but what it's there for is if you do wake up with symptoms of COVID, flu-like symptoms, or you've been exposed to someone who's got COVID, or there's a family member in your house that's got COVID and you're not feeling so good, this allows you to go, instead of to an emergency room, you can go to the monoclonal treatment facility and get treated with an antibody that'll help boost your system to help ward off the other, ailments of this disease and hopefully keep you either out of the emergency room or out of the hospital.
Don, what have you seen? Is it too early to see a number of people that have reacted positive? What have you seen? And if people want it, how can they get it?
So we're actually getting really good feedback from people. For example, I got an email one day because my name's on press releases. So a woman reached out to me and said that her daughter was feeling bad and would we take walk-ins at the clinic? And I told her we would. And believe it or not, I got another email from her later that evening saying that her daughter had received the treatment and was already feeling better. And she was very thankful that we had that. So our clinic is open 7 days a week from 9 a.m. to 7 p.m. And we do take walk-ins. Appointments are preferred, and you can get an appointment at www.patientportalfl.com.
That's good information because even getting appointments right now for a lot of people across medical fields has been hard. Do people need insurance? Because the cost is going to be one thing that a lot of people wonder about.
So the treatment is free, but if you have insurance, they will ask for your insurance information. It's one way the state can help recoup some of the money that it's using to have this program, but there will be no out-of-pocket expenses.
Well, that's good news for a lot of people. Anything else, Don, that we haven't hit on that you want people to know about this treatment?
Well, we want people to get the vaccine. That's the best remedy, at least for, keeping you out of the hospital and keeping your symptoms down. But there is, fortunately, this treatment available if you do wake up with symptoms or you do develop symptoms of COVID. The bottom line is we need to work our numbers down. We need to keep our emergency rooms from being overcrowded. All of the hospitals have implemented their surge plans, and we're doing whatever we can, and this monoclonal treatment is one way we can do it, to keep those people out of the hospital and hopefully recuperating at home instead.
That's a great point, because I was looking through some doctor office wait times around Seminole County. They were up to 5 hours yesterday. I mean, people have really struggled, and obviously the doctors and nurses treating them struggle to keep up with that demand right now.
Sure, you can wait, 5 hours in an emergency room, or you can get the monoclonal treatment. That'll take you about an hour to 2 hours.
Yeah, I think a lot of people would decide which one they want to get to. Brevard County Director of Communications, Don Walker, thanks for all the insight this morning. Good to see you.
Sure, thank you.